عن Epidemiology of Periodontal Diseases. الحقيقة المحاضرة هتتم على أكتر من محاضرة، أو التوبيك هيتم على 3 محاضرات. المحاضرة الأولانية هيكون فيها Classification of the Indices, Plaque Index, Oral Hygiene Index, and Gingival Index. زي ما قلنا قبل كده، the index is a numerical value describing the relative status of the population on a graduated scale with definite upper and lower limit designed to permit and facilitate comparison with other population classified with the same criteria and method. The index should be simple, reliable disease indicator. It requires minimal equipment and expense. Should have a clear-cut criteria. Amenable to statistical analysis. سهل إن أنا أعمل له تحليل إحصائي عشان أشوف هو عالي هل هو واطي بالظبط. Record health condition and facilitate comparison with other. The indices used for the assessment of the periodontal disease هنقسمها ل3. Indices for measuring the extent of dental plaque and oral hygiene performance as an etiologic factor for the periodontal diseases. Indices measure the amount of gingival inflammation, edema, bleeding, and clavicular fluid flow. Indices for measuring the extent of destructive periodontal diseases. Indices اللي أنا ممكن أستخدمها for measurement of the oral cleanliness عندنا plaque index, plaque formation rate index, oral hygiene index, oral hygiene index simplified, patient hygiene performance index. For the gingival problem, gingival index, papillary marginal attached index, gingival bleeding index. For the periodontal condition, periodontal index, periodontal disease index, community periodontal index, community periodontal index of treatment need. مش هناخد كل دول، احنا هناخد بس في المجموعة الأولانية the plaque index and oral hygiene index simplified. في المجموعة التانية هناخد gingival index، وفي التالتة هناخد the periodontal index and the community periodontal index of treatment need. Periodontal index may be classified either irreversible index, irreversible index, composite or complex index. Reversible index measure the reversible condition. For example, the gingival index and the plaque index. ممكن أوي أعمل measurement للgingival index وتديني score، بعديها بأسبوع لو البيشنت follow up oral hygiene instructions هيقل الليفل، هيبقى مختلف. Therefore, it is a reversible index. Irreversible index example ليه the periodontal disease index. Composite index يعني this index have a criteria measuring reversible condition and criteria measuring irreversible condition. احنا خدنا الكيرز indices. طب تعتبروا الكيرز indices هل هي reversible؟ هل هي irreversible؟ هل هي composite or complex index؟ حد يقول لي reversible، ما احنا decayed component ممكن اعمل لها filling فبقت filled component. حد تاني ممكن يقول لي لا irreversible. طب ممكن رأي آخر يقول لنا it's a composite. It combined dental caries experience, decayed component, filled component, and missed component. Actually احنا قلنا الclassification with measure reversible disease or irreversible disease. هناخد example. ال DMF هو مجموع ال D زائد ال M زائد ال F. Suppose we have a patient جالنا عنده 3 teeth decayed, no missed teeth, and 1 filled. Therefore, the DMF of this patient is 4. البيشنت راح للدكتور قال له ال3 decayed دول في واحدة منهم irreparable وهضطر إن أنا أعمل لها extraction فاتضافت إلى الميست component and the two other could be filled فبقى عندي 3 filled 1 miss and 0 decayed. Still, a DMF score is 4. All caries indices are irreversible index. Dental caries manifestations remain, even the lesion is treated. To record indices هنحط بس كده scheme عشان نمشي عليه. إيه الهدف منه؟ It is examined what are the criteria used, scoring system, and suggested nominal scale. Start with the index for measurement of dental plaque. أول واحد هنتكلم عليه plaque index of Louis and Sonos or Sonos and Louis. The purpose of this is to score the location and the quantity of the dental plaque. This index usually used with the gingival index. They have the same author. Teeth examined, either to examine all the teeth, and each tooth will be examined from the buccal, lingual, mesial, and distal surfaces. Or to use a partial recording system, it is used for epidemiological study where I studied a large number of population where it is difficult to examine all the teeth in each individual. These teeth are upper right lateral and first permanent molar, lower left lateral and first permanent molar, upper left 4 and lower right 4. The criteria for examination depending described on a scale running from 0 to 3. 0, no plaque. 1, the plaque at the free gingival margin, detected only with a probe. 2 is a moderate amount of dental plaque can be seen by the naked eye. 3, heavy plaque. How to score? First, the plaque index for each tooth is calculated. A total score of the 4 surfaces divided by 4. Plaque index of the patient means the total scores of all teeth examined divided by the number of the teeth, whether you examine all the teeth or only 6 teeth. The plaque index for the group equal to the total scores of plaque index for all individual divided by their number. Then the reading, what does it mean? It's called a nominal rating scale, which have a range from 0 to 3. 0 is excellent, good, 0.1 to 0.9, fair, 1 to 1.9, poor, 2 to 3. Let's take an example. Here we have 6 teeth to be examined. Each tooth examined from the labial, lingual, mesial, distal. For example, upper right lateral. The labial surface have a moderate amount of dental plaque. Takes score 2. The same for the lingual. The mesial and distal surfaces have minimal amount of dental plaque detected only with a probe. Takes score 1. The same for all teeth. Each tooth, the plaque index of the tooth is recorded. 2 plus 2 plus 1 plus 1, 6 divided by 4, the total is 1.5. The same for all teeth. Then the plaque index of the patient is the sum of 1.5, 2.25, and so on, divided by the 6 teeth examined. The total is 1.5. The plaque index for this patient is 1.5. What does it mean? This patient have a fair rating of the plaque index. Another case, we have all these surfaces have score 2, 3, 1, and so on. Calculate the score for each tooth. Sum all of the teeth to get the plaque index for the patient. 1.92. Fair ended by 1.9. Poor started with a 2. How can you rate this? أكيد الاتنين مش هتقرب، فيبقى الأقرب ليها إنها تبقى fair rating. If this decimal could be added to the adjacent، لو أقدر أقربه، يعني مثلا لو كانت 1.97 يبقى it is 2. صور جميلة للنيل في أسوان. Oral Hygiene Index and Oral Hygiene Index simplified. The purpose? To measure the extent of the debris and the calculus as indicator of oral cleanliness. طب الكالكولس وعارفينه والبلاك وعارفينه. What does it mean by debris? Debris hail, dental plaque, materia alba, any deposits. Teeth examined, it differs from the oral hygiene index or oral hygiene index simplified. الأورال hygiene index all the teeth examined. أمال يعني إيه كلمة sextant؟ أنا قسمت الأورال cavity into 6 areas. 3 for the upper and 3 for the lower. The upper, we have an anterior area starting from the canine to canine, right posterior from 4 to 7, and the other the same. I examined all the teeth from the buccal and lingual surface, but only the worst in each quadrant is recorded. Therefore, I have 12 teeth surfaces for 6 teeth recorded only. Suppose the upper central is the worst. Therefore, I will record its score of the pucker and the palatal surface. The oral hygiene index simplified only 6 teeth surfaces were recorded. It is suitable for epidemiological study or examining a large number of the people. It is easiest. The 6 teeth surfaces are the labial surface of the upper central, upper right central, lower left central, the buccal surfaces of the first permanent molar, the lingual surfaces of the lower first permanent molar. Again, for oral hygiene index simplified, all the teeth examined from the buccal and lingual, we have 12 surfaces recorded for 6 teeth. For the oral hygiene index simplified, 6 teeth surfaces were examined and 6 teeth surfaces were recorded. Either the oral hygiene index simplified or the oral hygiene index have a 2 component. One, oral debris and oral calculus. Debris index score is so easy to understand. It has a scale running from 0 to 3. Look here, no debris. Debris covering less than 1/3 of the tooth surface. Debris covering between more than 1/3 and less than 2/3. Debris covering more than 2/3 of the tooth. No debris, soft debris, not more 1/3, between 1/3 and 2/3, more than 2/3. Sometimes you find a patient having an extrinsic stain. Here, limited to the gingival margin. Here, covering more than 2/3 of the tooth. Regardless of the surface area covered, if you find a stain, it gets scored 1. Stain scored 1 regardless of the surface area covered. Calculus index, the same as the debris index, but here we have 2 types of the calculus, supragingival and subgingival calculus. The supragingival calculus, the same as the debris, no calculus, less than 1/3, between 1/3 and 2/3, more than 2/3. In score 2, we added also individual flex of subgingival calculus. Here, a continuous band of subgingival calculus. No calculus. Supragingival less 1/3. في score 2, supragingival between 1/3 and 2/3, or any individual flex of subgingival calculus. Score 3, more than 2/3 of supragingival calculus, or any heavy band of sublingual calculus. Here, what score you could give؟ هتديلها سكور كام هنا؟ هنقعد نفكر يا أكتر من التو ثيرد ولا أقل من التو ثيرد. من غير ما نفكر أنا مستخدم ده oral hygiene index simplifier which record only the labial surface of the teeth. وبالتالي لو لقيت ده it will not be recorded because it is in the lingual surface of the teeth. يعني أنا عندي calculus and not recorded. عشان كده في ال clinical trials small number of patients it's preferable to record the oral hygiene index, not the simplified. How to score? Score first the debris index. The debris index of the 6 surfaces divided by 6. Calculus, the calculus index scores of 6 surfaces divided by 6. Then sum both of them to get the oral hygiene index simplified. We have a chart. Here, upper or lower. We have a right molar, anterior left molar. For the upper molar, we record the buccal. Anterior labial. Molar left, buccal. Here, this patient have more than having soft debris covering more than 2/3 of the buccal surface of the upper right molar. Have a debris index or debris scores covering between 1/3 and 2/3. Here, covering more than 2/3. For the lower, I scored the lingual. The lingual surface of the lower first molar have a debris between 1/3 and 2/3. The labial surface of the lower left incisor have a debris less than 1/3, and so on. Compute the upper 8, 5 divided by 6 surfaces, the total is 2.17. The same for the calculus index. You have to score H2s, then get the total divided by 6. It is 1.17. The oral hygiene index simplified is the sum of both. It was 3.34. Debris index calculated, calculus index calculated separately, then sum of them to get the oral hygiene index simplified. It was found in the previous case to be 2.17, here 1.17. The total is 3.34. Return to the rating scales. 3.34 means a poor oral hygiene condition. This patient has a poor oral hygiene condition. Another chart. A child aged 8 years old examined for the presence of oral cleanliness, and the following was found. The labial surface of the upper central incisor had a debris covering between 1/3 and 2/3 of the crown. It takes score 2, yes. The labial and lingual surface of the lower left central incisor is covered totally with a stain. Once I see a stain, I will score 1. But here, he tell you the labial and lingual. في الأورال hygiene index simplified, only I record the labial. Therefore, I will put score 1 only. Debris covering more than 2/3 of the buccal surfaces of the upper molar means score 2 for both sexes, and lingual surfaces of the lower molar also means score 3 for the lower sexes. Non-calculus was detected except individual flicks of subgingival calculus means score 2 at the lingual, okay, of the lower right sex. We will put all the teeth, put the scores, calculate the debris index scores divided by 6, 2.5. For the calculus index, only the lower right six have individual flicks of subgingival calculus. Score 2, all others 0. Therefore, it was 0.33. The oral hygiene index simplified will be 2.83. Return to the scales. 2.83 means a fair rating of oral hygiene. And this is for measuring the amount of gingival inflammation. Here we will discuss the gingival index of Louis and Soulness. The purpose of this index is to assess the prevalence and severity of gingivitis, whether in epidemiological studies or in a clinical trial, as well as to evaluate the effect of preventive agents in the clinical trials. The teeth examined could be to examine all the teeth as plaque index or select a partial recording system or select specific teeth. Observe these teeth are the same for plaque index. 6 teeth. Each tooth will be examined from all surfaces, mesial, distal, buccal, lingual. What are the criteria? I ask for gingivitis. The inflammation mainly includes redness, edema, and bleeding. Therefore, we suspect that we search for these criteria. The criteria running on a scale ranging from 0 to 3. Here, no inflammation and the gingiva is normal. 1. Mild inflammation, moderate inflammation, severe inflammation. To be easy عشان أسهل هحط الثلاث كلمات اللي احنا قلنا عليهم redness, edema, bleeding في الثلاثة scores. Start by mild هحط جنبيها كلمة slight redness, slight edema and no bleeding on probing. هاجي عند moderate شلت slight خالص، عندي redness، عندي edema، عندي bleeding on probing. في severe inflammation حطيت كلمة marked redness and edema، يعني marked redness, marked edema, and there is a spontaneous bleeding and ulceration. How to score? First, score the gingival index of each tooth. Gingival index of the 4 surfaces divided by 4. Gingival index of the individual equal to the gingival index scores of the 6 surfaces of the 6 teeth examined divided by 6. If you examine all the teeth, يبقى gingival index score of all teeth examined divided by their number. For a group, the gingival index scores of all individuals divided by their number. We have a chart as an example. If we examine 6 teeth, use the partial recording system. For upper right lateral, I examine each tooth from the 4 surfaces. Labial, normal. Lingual, mild. Normal, normal. Write the scores. Normal, 0. Mild, score 1. Normal, normal, 0, 0. Divided by 4 to get the gingival index of the tooth. Here, for example, the lower left Lateral, you have a moderate gingivitis, score 2. Moderate, 2. Normal, 0, 0 divided by 4. The same for all teeth. Then, the gingival index of this patient will be the sum of all teeth scores divided by the 6 teeth. It will be 0.87. Return to the rating scale. We have gingival index of this patient equal to 0.87. It means this patient have a mild form of gingivitis. Thank you and welcome for any question.